Good afternoon, everyone, and welcome to this webinar launch of the Moving and Nourishing databases. It's a great pleasure to welcome you all. This is a very exciting event for us to finally be able to launch these databases. Next slide, please. Just some housekeeping before we get started. Please use the question and answer function to post comments and questions during the webinar. And there will be a chance to ask questions at the end of the webinar. We will also provide a recording of the webinar and the slides post-webinar. My name is Knut Klepp, and I'm the coordinator of the Cocreate project. And Cocreate stands for Confronting Obesity, Co-Creating Policy with Youth. And I'll give you a very brief presentation of the project. The main objective of Cocreate is to investigate how policy changes can support healthy eating and physical activity lifestyle with the aim of halting the rise of adolescent obesity rates. And we have two main objectives then. One is to provide monitoring and evaluation for relevant policies. And the other main objective is to include, involve, and engage youth and adolescents across Europe in health designing policy that might be relevant for healthy eating and physical activity. Next. Cocreate consortium consists of a number of partners, both universities throughout Europe and the US, Australia, South Africa, and also a number of non-governmental organizations and advocacy organizations, including youth organizations. And we also collaborate closely with the World Health Organization. Next, please. What we're really aiming at then is to be able to assess policies that are being designed and implemented to help promote healthy eating and physical activity, to survey and monitor youth engagement in risk-related behaviors, and also to assess and look at development in overweight and obesity rates. Next. Youth are really engaged in a number of political questions. This picture illustrates engagement from the climate strikes that went on last year. Next. The objective of Cocreate is to see how we can engage youth also to get involved and formulate policy agendas when it comes to obesity prevention by feeding and providing information from existing policies, ongoing research, and also system mapping of what factors youth themselves think are important both in their life and for youth in general, and to see then through a number of activities how this might translate into a policy agenda that can then be modeled and evaluated to see what kind of impact it might have on obesity rates. So the purpose of the meeting today is to present these databases. And the Moving and Nourishing database provides an overview of policy action from around the world that promote healthy diets and physical activity, structured around these two frameworks, nourishing and moving. And these databases are set up then to show where action is needed, identify and monitor what other countries are doing, identify evidence for policies, and also identify research gaps. The objective of the webinar is to better understand the challenges of addressing obesity across Europe and the policy response, launch a new web platform and explain how it works, show how the policy databases can promote healthy diets and increase physical activity, highlight the importance of prevention policy, especially given links with COVID-19 and underlying health conditions, including obesity and other non-communicable diseases. And then to discuss the challenges and opportunities for policy development in nutrition and physical activity, and highlight the database as a tool for youth engagement and policy co-creation. So following my brief introduction, we will have a presentation from Dr. Kremlin Wickramasinghe from WHO Europe. Then we will have a presentation of the database from the World Cancer Research Fund International. And then we will have 3 brief introductions looking at how these databases might help support the development of nutrition policy, how it might help the area of physical activity, and also look at the youth, how youth can benefit from these kind of databases. And then, as I mentioned, we will leave time for question and answers towards the end of the webinar. Next, please. So first then, it is a great pleasure to give the word to Dr. Kremlin Wickramasinghe, who is Technical Officer at the World Health Organization Europe office in Moscow. So please, Kremlin.
Thank you, Cocreate. And yes, my name is Kremlin Wickramasinghe, and thank you to World Cancer Research Fund International and to the Cocreate project for inviting WHO Regional Office for Europe to join this webinar. Next slide, please. And as you know, WHO has been a partner of this project and working with many other stakeholders in the European region. WHO European region consists of 53 countries. You can see on the map, Western European countries, Eastern Europe, and former Soviet Union countries. We have a project called COSI, Childhood Obesity Surveillance Initiative, where we measure primary school children, 79 years old in many countries, nearly 40 countries now. So this is just a map. You can see the prevalence of overweight, including obesity, across the region. And dark red means higher levels for both. You can see the map for boys and girls. Next slide, please. Our data shows that for boys in some countries, more than 40% of them fall into this category of overweight or obese. And that is quite remarkable given all the work we are doing around childhood obesity. Still we are struggling to turn the tide. Whereas in some countries still it's rising around 10%. Next slide, please. Similar picture for girls, but still a little bit less than boys, but some countries still around 40% of the girls are overweight or obese, and less so in some Eastern European countries. Next slide, please. What I showed you earlier is primary school children, but now this is a slide for 11 to 15-year-old from health behavior in school age children survey. You can see in different parts of our region, like Western Europe, Southern Europe, Eastern Europe, Northern Europe, between 2002 and 2016, the obesity levels, overweight and obesity has been consistently going up. But the fastest rate of increase is in Eastern Europe. So it's not a problem for any particular group of countries. This is an issue for across the region, and we are working with all member states to collect better data and to provide them with information to better inform their policies. Next slide, please. And what kind of policy options, of course, we are talking about. I didn't present any data on physical activity level or diet, but we have that data related to these children. And we really see in areas where the fastest rate of obesity among children, also we see in the same countries that the children are consuming more sugary drinks. That's why we are proposing policies such as fiscal policies to promote healthy foods, or taxation of sugary drinks and other snacks, and also how to promote healthy food. And then reduce exposure to marketing. Policies especially focusing on digital marketing, where children are spending more time in digital environment. Especially in the COVID-19, now children are learning remotely. There's more time they're spending on devices, which can increase their risk for more marketing. And also working with countries to improve our data collection. and then we can provide better data inform the policies, creating healthy food environment in all settings, including schools and daycare settings. And adequate facilities at school for physical activity, because although it is a recommendation, we find out the implementation is very low in most of our regions, most of the schools, due to lack of facilities. And then taking a life course approach, not just at one point in life, pregnant mothers, then promoting breastfeeding, early childhood, even collecting data for children under 5, and then primary school, secondary school, and elderly. How can we have a policy framework which affects across the life course? So these are some of the policy options that we are promoting in a wider challenge. Thank you very much, and that's all. We look forward to the discussion.
Thank you very much, Kremlin, for that great overview. And then it's a big pleasure for me to introduce the World Cancer Research Fund International, who are then responsible and have developed the databases. And with us from the World Cancer Research Fund International, we have Dr. Kate Allen, who is the Executive Director for Science and Public Affairs. And we also have with us Kate Aldridge Turner, Head of Policy and Public Affairs. And they will then give an introduction and present the database. So please.
Thank you very much, Knut Inge, and hello everyone. So I'm going to just spend a few minutes giving a bit of background to the development of the Nourishing and the Moving databases. Can I get the next slide, please? I'm actually going to start in the area of science. So you might be aware that World Cancer Research Fund International collates and analyzes the evidence around cancer prevention and survival on food, nutrition, physical activity, and weight through our continuous update project. So that analysis informs the development of our 10 cancer prevention recommendations, and you can see the recommendations there in the slide. So those recommendations collectively form a package of healthy lifestyle choices that together can make a huge impact on someone's chances of developing cancer. And then, in fact, there's a lot of evidence now showing that following a dietary pattern that's close to the recommendations significantly reduces the risk, not just of cancer, but also other NCDs. And that's, of course, because of the shared risk factors. So to give people the best chance of following the recommendations in a real life setting, we need healthy environments for people to make their choices within. And of course, for that, we need policy. Next slide, please. So just as we update the evidence for science, we wanted to do the same for policy so that we had a policy offer that would cover our cancer prevention recommendations at a population level. So to start that process, in 2013, we developed our Nourishing policy framework to promote healthy diets and to reduce obesity. And you can see the framework there on the right of the slide. So each of the domains and the policy areas in Nourishing was identified through a review of existing policy frameworks, proposed and implemented national policies, and also evidence of policy impact. So you can see that there are 3 policy domains in Nourishing across the top there: the food environment, the food system, and behaviour change communication. And then within those 3 domains, there are 10 policy areas. And each is represented by one of the 10 letters of Nourishing. So for example, N is all about focusing on nutrition labelling, for example. So we then developed a database of nutrition policy actions that was structured around those letters of the Nourishing framework. And then later on in 2016, we started to add evaluations to the database so that we could assess the impact of the policy. And I think it's important to note that the concept behind Nourishing and also Moving is that policy action can't happen piecemeal, or it shouldn't happen piecemeal. So to get the best chance of a fully effective and joined up response, action needs to be taken across all of the areas of the Nourishing and indeed the Moving frameworks. So then coming to 2018, WSOV International joined the Cocreate consortium. And a part of our work on that project focused on developing tools for policy monitoring and assessment. And as part of our work on that, the opportunity arose to develop a policy framework for physical activity that was analogous to the nourishing policy framework for healthy diets. Next slide, please. So that brings us to Moving. Moving was created in 2018, and it was done following an analysis of the global physical activity policy literature. And that included the WHO Global Action Plan for Physical Activity, the GAPA. And we also consulted extensively with physical activity policy experts as part of the project. And then the findings were refined into 6 policy areas, and you can see them on the right of the slide there. 6 policy areas according to the Moving acronym. Next slide, please. So Moving is primarily structured around 3 domains. You can see them at the top there: active societies, active environments, active people. And importantly, the 6 key policy areas that you can see that make up the acronym Moving align with the 4 policy areas of the WHO GAPA. Then there's also a 4th overarching policy domain, active systems, and you can see that on the extreme right-hand side there of the slide. And that looks at the key attributes that are important in policy development, so things like governance, leadership, physical activity, surveillance, and so on. So just like nourishing, each letter of Moving represents a separate policy area. So just looking at M, that's all about making programs, initiatives, and activities that promote physical activity a priority. The Moving framework is underpinned by a new database of physical activity policies that we'll see shortly. And then for the active systems domain, we'll be collecting good practice examples, so case studies, to highlight actions that are being taken in that area. So I hope that's been a useful, quick grounding in the databases and introduction to them. And now I'm very pleased to introduce Kate Aldridge Turner, who, as you heard, is our Head of Policy and Public Affairs at WSEF International. And she'll take us through the databases in more detail and show us more about them. Thank you very much. Next slide, please.
We're going to show you around the updated Nourishing database and the new Moving database and explain how you can search for nutrition and physical activity policy actions. To enter the Nourishing database, click here. This reveals the 3 policy domain areas by which the Nourishing database is organised. We have the food environment, food system, and behaviour change communication. Here, under the 3 policy domain areas, we have 10 policy areas, and each policy area stands for one of the 10 letters of the Nourishing framework. We are going to explore the policy area N, Nutrition Label Standards and Regulations on the Use of Claims and Implied Claims on Food, to see how the sub-policy areas are organised. If we click on the policy area, all the sub-policy areas are then revealed. Within N, we have lots of sub-policy areas, including clearly visible interpretive labels and warning labels. If you click into a sub-policy area, it reveals all the different policy actions. A policy action is any form of government action, including, but not restricted to, legislation, regulation, decrees, standards, policies, programmes, fiscal measures, and government-sponsored or endorsed voluntary action and agreements. We only collect national policy actions that are currently in effect and have been verified by an in-country expert. Here we have policy actions from Australia and Brunei, to name a few. For each policy action, we have a policy title, short description, and list the country and topic it relates to. Where we have the information available, we also include a policy evaluation. These will be independent evaluations that assess the impact of the policy. You can find out how we decide which evaluations to include on the database. All the information can be downloaded into a CSV file, and there are tips to help you interrogate the data. You can also navigate around the database by going back to the homepage using the tab at the top and using the search function. This time we will explore the Moving database to look at physical activity policy actions. Moving follows the same structure as Nourishing and is organised into 3 policy domains. These are active societies, active environments and active people. Under these 3 domains are 6 policy areas. Each letter of Moving stands for a policy area. Each policy area covers a range of policy actions that are needed to get people more physically active across their entire life, including at school and in the workplace. This includes active travel through walking and cycling infrastructure and access to green spaces and educating everyone about the benefits of living an active life. You can click through the policy and sub-policy areas to see the policy actions. You can also select a database to search. Now we will search for physical activity guidelines in the Netherlands in the Moving database. You can type in the topic you are searching and the country and hit enter. This then reveals all the results, listed under the relevant sub-policy area. If you click here, it will reveal the relevant policy action. In this case, it's the physical activity guidelines in the Netherlands. Again, you see the name, short description and country, as well as the topics it is tagged under. If you return to the home page and look at the search function, you will see that when you start a search, you have the option to filter by policy action that is accompanied by an evaluation. You have the option to search for recently added policies, as going forward we will tag all policy actions uploaded to the site. This will mean that you'll be able to see what's been added in the last 3 months. The databases will be updated on an ongoing basis with policy actions we've sourced through policy scanning. There is more information about how we search for policies on the policy databases and the WCRF website.
Thank you. So I'm going to give you a quick introduction to how we source policies. So the Moving and Nourishing databases are continually updated through 2 scans, a comprehensive scan of 27 European countries and a global scan. The European scan is an in-depth, systematic search to find as many policy actions as possible given the European scope of the project. The global scan uses ongoing surveillance to identify policy actions. As we've been collecting policies for the Nourishing database for a longer period of time, there are currently more policies in the Nourishing database than the Moving database. Moving currently covers 6 countries: Latvia, Netherlands, Norway, Portugal, Poland, and the UK. However, this is being continually updated and will soon contain a lot more. Next slide, please. We are adding new policies to the database all the time. To do this, we use a well-defined methodology for searching and identifying policies and including them in the database. This includes strict inclusion criteria, such as that all policies included must be currently in effect, have been enacted by the government and be national level. All policies are verified by an in-country expert within the corresponding ministry to ensure it meets the scope of the database. We're grateful to WHO Euro for helping to facilitate the introductions to the in-country contacts. We will include some local policies where they're best practice example. However, as a rule, we only focus on national policies. Next slide, please. The Moving and Nourishing database have a number of features worth highlighting. You can share your search results on social media, including Twitter, Facebook, and by email. You can also download your search results in a data CSV file, so you can store and analyze and search the results for yourself. We've also created search tips and a guide on how to interrogate the data. And the database now has a glossary of definitions of commonly used terms throughout the database. So you understand what a policy action is or a sub-policy area. We explain it all. The database is updated on a continual basis, and you can also search for policies added in the last 3 months. Next slide, please. So what's happening next? WCRF International has a range of exciting new projects and developments coming up as part of the Cocreate project. For the database, that includes completing the comprehensive scan of the selection of European countries. The global scan for policies for moving and nourishing will also continue. If your country has a new physical activity or nutrition policy we've missed, please let us know. We can include it. As I mentioned, we'll ensure that the database is updated on an ongoing basis. And moving forward, we're starting to analyse the policies we have in our database by rating the strength through a new policy benchmarking system that's also been developed as part of Cocreate. When that tool is finalised, we hope to be able to compare policies and make recommendations on how countries can strengthen their nutrition and physical activity policies. Lastly, we will continue to work within the Cocreate project to advocate for strong nutrition and physical activity policies. We are working on the release of a policy brief about the rates of childhood obesity and the policy response in a number of European countries, and a journal article about our forthcoming benchmarking tool. So just a little flavour of things that are coming up. Next slide, please. Lastly, from my side, just here are a number of useful links to the database and other resources within the Cocreate project. So we have the link for the policy database, also the Healthy Voices website, which is the more youth-orientated website within the project. You can access the databases there, and also the Cocreate project website, which gives you more information about the project. Thank you very much. That's all from me, and now back to Knut Inge.
Thank you so much for that excellent overview. This is really exciting to see. Then we have two presentations from the United States, and because of the time difference, they have been pre-recorded. So if you can have the next slide, please. So the first presentation is by Professor Barry Popkin. He is a W.R. Keenan Jr. Distinguished Professor of Nutrition at the UNC Gilling School of Global Public
I'm Barry Popkin from the University of North Carolina Global Food Research Program and Gilling School of Public Health. We have been working with nourishing from the day it was launched. How do we use nourishing? We provide data for it, provides data for our maps on up-to-date kind of laws in many countries in which we don't have involvement. We keep it ourselves as one important repository for laws and regulations, and we provide many English and local language laws to them, to the website and to the people running it. I get constant emails from students every week, every day almost, asking something about a policy or a program in one country or another, and all I do is refer them to Nourishing to find out about that country as much as they want, and it really works. It's very helpful. And we use these maps that I'm going to be sharing for many reasons. The World Bank published them in their obesity strategy document. Many others have published them in a variety of different journals or other sources, and we think that's great. We provide them online on our website for any kind of use that people want. And if people want to use them in an article or other things, we share with them the latest updated versions. Here are some of the maps we've created. This is on sugary taxes. We actually have one for each region where we go in much more depth into the law in that region. Soon we'll have these interactive and even provide more detail. Secondly, we do the same thing on front of the package profiling, in this case with all the logos that are legally required by the countries. We do the same thing with all the statutory and voluntary self-regulations on marketing. This is just an example. And in all these cases and so many others, without Nourishing, we really wouldn't have the source to deal with all of this and inform our advocacy and research partners globally. Thank you, and I strongly recommend everybody look at the Nourishing and at the new physical activity component, which I think is fantastic. Thank you very much.
So then the next presentation is by Professor Jim Salas. He is a distinguished professor in the Department of Family Medicine and Public Health at the University of California in San Diego. He is also serving on the advisory board of the Cocreate project. Thank you.
Hello, my name is Jim Salas. I am calling in from San Diego, California today, and I'm really pleased that the Moving and Nourishing databases are having a good launch, and I'm going to offer my comments on the Moving database. I'm going to organize my thoughts by first mentioning the framework itself, then the scans and the data collection, and then the database, and finally some ideas for next steps. Regarding the framework, I'm really pleased that it acknowledges the multiple roles of policies in promoting physical activity, and that it's consistent with the World Health Organization Global Action Plan on Physical Activity, or GAPA. And both are organized around the main pillars of systems, people, environments, and governance. And all of these are important and probably needed. I'm also pleased that the framework is informed by research, as is all of the rest of the activities and components, and recognizes the roles of multiple sectors. It's very important to consider the impact of not only public health, but also healthcare, transportation, urban planning, education, and other sectors. Maybe it's important to comment on whether these physical activity policies are still relevant in the period of COVID-19. And to me, the answer is yes, in all capitals. Physical activity has many likely benefits for the infection itself because of the impacts on immunity and inflammation, as well as in the coming days, hopefully, we'll have a vaccine, and physical activity boost the response of the immune system to vaccines, especially in older adults. And of course, physical activity is an effective stress reducer and mental health promoter, which is extremely important to everyone. So now let's talk about the scans. The deployment of the coding instruments and the rules was very demanding. The complexity of the policies meant that input was needed from a wide variety of stakeholders. So I think that was very well done. The scans also had to be suitable for diverse governance systems and traditions across countries. So this was a big challenge. And it provided guidance, the instructions provided guidance on finding the policies because they're going to be in different places in different countries. And I was pleased that the scans made for distinctions between the adoption of a policy and the implementation of it, because those are far from the same things. Now let's talk about the database, which is the reason we're celebrating today. The Cocreate project provided opportunities for field testing of the scans in multiple countries. And so now there are data to look at, there's an experience to build on, and I'm pleased that the procedure includes verification of the data across countries in each country. That is also important. So I'm expecting that there will be revisions made in the instructions, in the training, and in the scoring. And this is needed for wider applications. So the moving process has come a long way. Here are my thoughts about potential next steps. a good beginning is to use the data collected for Cocreate for research purposes, for advocacy purposes within countries, and hopefully for government decision making. I would expect that a goal is to expand this process throughout Europe and potentially to other countries, so that there becomes a robust international database on policies that can be used by many people for many purposes. But I would expect that there would be need for ongoing support for this data collection and for training that I would hope to see become automated and available online to make it more feasible for expansion. One thing to look forward to or to plan for is to create a community of users. Let's see. So this would help make the data more useful for research, advocacy, and government decision making. All right. So finally, I would love to see this process adopted into routine government use so that it could become repeated every so often and be part of government decision making. And this could help create a more active world, which is what we are all hoping for. So thank you, and please have a wonderful celebration of this milestone. Bye-bye.
So those presentations gave good illustrations of how these databases are being used, can be used, and also some of the methodological complexity behind creating them. And we got some good advice here for how we can take them further and use them in the future. PRESS is the Norwegian youth organization under Save the Children, and it's a formal partner of the Cocreate.
Hello.
And now we will hear from Margaret Bjorg, who will discuss how youth can benefit from the database and how it will support engagement in the policy co-creation activities. So Margaret, over to you.
Hello everyone. I'm really happy to be here and celebrate the launch of the Nourishing and Moving databases. As just said by Knut Inge, my name is Margaret and I work in PRESS, Save the Children's youth organization in Norway. We are a youth organization consisting of about 1,000 members in the age from 13 to 26 years of age, fighting for children's rights as formulated in the United Nations Child Rights Convention. And the Child Rights Convention is often said to have 4 basic principles that are fundamental to the fulfillment of the rest of the convention. One of these is the child's right to be listened to and taken seriously. The right does not only apply to everyday decisions that are directly affecting the child, but also in broader political and administrative questions. In PRESS, we call this the right to participate. And the right to participate is important of several reasons. Young people will live with the long-term consequences of today's policies, and that makes it important to ensure that they can affect the decisions that are reached. In addition, youth participation can ensure more accurate policies and help anchor decisions, in addition to working as a school in democracy, preparing children and youth for a lifelong democratic participation. And maybe most important, that children and youth have a voice is an important part, of democracy itself. And I think most of you can agree. The next question then becomes, how do we involve youth? According to Hart's well-known ladder of participation, good youth participation happens when young people and adults work together. Co-creation, which is something we've worked a lot on in the Cocreate project. Youth participation should not happen isolated from adults' decision-making structures, but rather within them. This way, young people can have an impact on discussions and decisions of importance. But when young people and adults come together to work on a topic, there is a power imbalance between them. A great part of this comes from the fact that adults are working with the subject often have more information than youth that are engaged in the same topic. Adults know the common used abbreviation and jargon. They are familiar with previously adopted policies, schemes, and plans, and if not, they know where to find the information they seek. This is in many ways natural. Adults have had longer time to learn about the topics that they're working with, and they often have full-time jobs where they can spend working hours to find more information and read further up. Youth, on the other hand, have lived a shorter life, and they often have to combine their engagement with attending school. So this is why I think that the databases that are launched today are so important. I think Nourishing and Moving can help contribute to real and meaningful youth participation. The databases are easy to navigate and use, and they gather information that otherwise would have taken a long time to find and summarize it in a comprehensive way. This can help youth advocate for and participate in debates about public health and obesity prevention. So Norwegian research has found that where engaged youth become involved in a project without actually having an opportunity to influence the decisions that are being made, this can give youth a feeling of powerlessness and distrust. This is why it's important not only to talk about youth participation, but to move the discussion to how we can ensure real and meaningful youth participation. This is why we need to look at the power balances and how we can spread information to as many as possible, securing that youth and adults can work together as equals. Often when we talk about children's rights to be heard, we think about the rights to be heard in matters related to everyday life. The United Nations Child Rights Committee have concluded that children has a right to say their meaning, and that this applies both to individual questions as well as political and structural ones. At the same time, structural topics can often be complex and hard to understand, and that's especially relevant for someone who's not used to working with policies. It can therefore be easy to point to individual responsibility and simplistic solutions to complex questions. I think that the databases that are launched today can be an important tool to show how one can think at the system level using policies to address the problem. It's often said that knowledge is power, and this makes it important to make knowledge and information easily accessible. I hope and think that the databases that are launched today can contribute to that and make sure that we have real and meaningful youth participation in policy making. Thank you very much.
Thank you, Margaret, for that very nice presentation, and also linking the work with the policy database to this, to the human rights perspective and rights of the children. Then we have quite some time set aside for questions and answers, and I see that there are some answers or questions out there. Can I ask our colleagues at the World Cancer Research Fund International to read or respond to some of the questions that have been asked?
Hi, this is Kate Aldridge Turner. I was just working through the questions. We had a question regarding the database to target directly. Mainly it is to target directly, but I think you do have to target physical activity, directly as a scope for inclusion. Primarily, yes, it is to, the primary objective is to promote physical activity, but naturally there are a lot of policy areas that touch promoting physical activity, such as active travel, urban design, and so that is also integrated into the framework as well, and is an area that we collect policies on. So it is a very multi-sectorial approach that the Moving framework really adopts and touches many areas. But like I say, primarily to promote physical activity, but we will look at those areas that indirectly as well. So I hope that answers that question. We had a question about creating a policy brief toolkit from a group of African physical activity researchers to share I think that's something we can certainly be in touch with you and collaborate. The beauty of this whole project is it's very collaborative. Obviously, we work with ministries, civil society, researchers from around the world, and we're really open to having discussions and seeing where we can complement and support each other. So we'd be really happy to follow up and have a conversation and understand and share ideas further. So we'd be really happy to do that. We had a question, do Big Food have access to the database and can they enter data? If so, what are the risks of distorting the data? That's a really excellent question. All the information is open access, but we are the custodians of what goes in. So there is a defined scope and inclusion criteria, and we manage that process. So I would say the issue around distorting the data we manage, but the idea is the information is available to all. So I hope that answers that question. When will policies from other countries be added to Moving, including policies from the US? That's a really good question. Basically all the time. So we are doing surveillance on an ongoing basis from around the world. As and when we know of policies, we will reach out to contacts in ministries, seek verification just to ensure that it does meet the criteria to sit in the database. And as soon as it does, then we'll publish it. As you may anticipate, we have some small bottlenecks with ministries being very, very busy with the response to the COVID-19 pandemic. So, but we're trying to manage that as best as we can and not let that be a bottleneck to information. We also really welcome, as I mentioned earlier, if you are aware of information, please let us know. We are very open to having those conversations and sharing information. So please do get in touch. But going back, we're basically trying to update it all the time, and that will include the United States. I have a question for Margaret, we have a question, so I may invite you to answer this one if that's okay. How old would you recommend the youth should be to participate in the policies? If you'd be able to unmute and answer that one.
Yeah, thank you for a good question. So I think we in press prove that children of all ages can take part of policy or working on policies. Our members are sometimes 12 years and we work in teaching them how they can do it, giving them information on how they can take part in the policy process. But of course, it's important to learn. It can be scary to participate in policy processes. And I think if you have training and if you have a safe place to practice beforehand, then you can start really early, I would say. Yeah, and our organization is run mostly by 19-year-olds, or people in their early 20s. So I think we're proof that you can start at an early age involving youth in policymaking. I don't know if that answered your question or if you want me to be more specific, but yeah, I hope so.
Whilst you're still on, I may invite you and Knut Inge. We have another related question, and then I'll keep answering the other questions to WCRF. And we have a question of, would you consider publishing on how to engage youth meaningfully? This would be very useful, meaningful lesson to document to many countries and organizations. So it might be helpful to hear about the other parts of the project within Cocreate and what they're doing.
Do you want to go first, Margaret?
Yeah, I can try to answer on how we've been involving youth in the Cocreate project, if I understood correctly. Yeah, so we've been working with youth alliances for overweight prevention that has been established in 5 different European countries, where youth aged 16 to 18 years old have been given training and participated in developing their own policies for obesity prevention. They've been co-creating the policies with scientists from the institutions that we are partners in the Cocreate project, and will participate in something called the dialogue forum to to work, like continue working on the policy ideas that they've been developing in the project, and to work on them with policymakers and other people working in the field of obesity prevention. So yes, this is one way that youth have been involved in the Cocreate.
And if I can just add that we are trying within Cocreate project, which is a research project, to carefully document all the experience we have, and the experience is quite rich, as we have different ways of recruiting and working with youth in different countries. So our intention is to publish quite extensively on what we see are good ways of involving and working with youth, and also when we have challenges, describe those and see how those can be overcome in the future. Thanks.
We had another question about youth being involved in the Cocreate project. I think that should answer that question as well. Obviously, youth are integrated throughout the project, and we, in the moving presentation, we've just specified on the database. I'm happy to continue to keep answering some of the more specific questions to WCRF. We have a question: will WCRF be undertaking analysis on the data and provide summary on which policies in which countries have demonstrated an improvement on obesity, or is it for individuals to undertake these analyses? So that is something we will be looking at later on in the project. We need to do more policy scanning to gather the information about policies, and then apply the benchmarking tool, and then looking at the statistics that Dr. Kremlin presented. So looking at all of that, that will be coming later in the project. So I don't have an immediate date to say when that will be, but it's certainly something that we will look at in more detail in the future. We have another question: do you include or have plans to include information on the evaluation of the policies? Currently, right now, we list the title of the evaluation and a link to it. Unfortunately, due to capacity, we just don't have the ability to summarize that evaluation. However, we do signpost users of the database to that evaluation, where you'll have all the information. Obviously, with so many data entries, we have to manage that process, but you will be able to access or find a link to that evaluation where we have it on the database. We had another question, wondering who are partner organisations who contributed to the database in relation to physical activity. We would love to explore further cooperation with ISCA, International Sport and Culture Association. Yes, we worked with a range of organisations and individuals. We would be happy to have a conversation with you. We want to strengthen our work in physical activity, so we would really welcome a conversation. I had a question, can you clarify the thinking behind not collecting policies for the active systems component of the GAPA, and also can the moving database be filtered by statutory or non-statutory action? So the active systems within our framework looks more at elements within policy development that are cross-cutting across all the policy areas. I know I'm throwing lots of jargon at you here, so apologies for this, but this is things like surveillance, governance, leadership, financing. So it's all these attributes that would be looked in the specific policy areas. So you wouldn't collect a singular example for one of them. There'd be elements that you would look at across the policy areas. I think what we'll do, obviously this is day one of this database, so it's a new beginning, an exciting new beginning, but we will look at how we display that information going forward that is meaningful and helpful to users. But as it's a cross-cutting area, it touches all those different areas. Next question I have is in regards to what you define as a policy action. I see familiar initiatives run in the mass communication campaign that are run by civil society organisation. Does this qualify? So what we do is there has to be a link with national government for it to be included in the database. So often the civil society initiatives that this question references in the mass communication element will have been developed in collaboration with the government or supported or received funding, and that's how it's included. A policy action is an action. We are focused on areas that governments are actually taking action. So it's not plans. We actually want to see what the government is doing. So we have a more tightly focused definition. It's a long list of things like laws, regulations, things like that. The definition is on the website. So yeah, we want to have a more action orientated approach to actually that it isn't an announcement or a commitment, but it moves action further forward. Are there any frameworks that you can share to help organisations co-create with youth? Well, our frameworks are designed to be user-friendly. We want youth to use them. So from our perspective, that's one of the objectives behind its design. I wonder if Margrethe has any other specific examples you could think of?
Yeah, I think, I don't know if we have any like frameworks, but I would suggest that you consult youth organizations where you are stationed to get their inputs on how you could involve local youth organizations in the work that you're doing. And also we've been working a lot with HEART's Ladder of Youth Participation. I don't know if you, Knut Inge, would like to add on what I said maybe.
I think that might be the most important thing, to really contact local organizations and work with them. But there are some theoretical frameworks like the ladder that Margaret just mentioned, and it is something we also hope to be able to publish more on from the Cocreate project.
I'm conscious that we're at the end of the session, but there are a lot more questions. So what we will do is make a note of all these and follow up with the individuals so you do get a response. And then I will hand back to Knut Inge to close the session.
Well, thank you very much, Kate. And again, congratulations to you and all your colleagues at the World Cancer Research Fund International for the fabulous work that you have been doing. I believe and strongly believe that these databases will be extremely useful both for research, teaching, advocacy work, and policy planning. I hope for all of those of you who have listened in, I've noticed there's been more than 200 people visiting from all over the world, that this had been a useful introduction. And I really encourage you to explore the database and also provide us with feedback. The Cocreate project is a 5-year project. We're just 2 years into the project. So we have a number of exciting research questions that we are addressing now, both doing comparison between the countries, see whether we can link policy development to risk behaviors among children and so forth. So we will really be exploring these databases and see how we can use it for research purpose, but also then to develop further how they can be used as useful tool with youth engagement. So with that, I just want to thank all of you for taking the time and spending time with us, and wish you all the best in exploring and using nourishing and moving in the future. Thank you and goodbye.